Hi everyone. Today's lesson is on late deterministic and stochastic radiation effects. Some of what I will cover today you have already learned in organic sensitivity and dose limitation modules, so it will be more of a review than new content. The objectives for today is to define late effects of radiation exposure, list the local tissue effects of radiation exposure, discuss radiation-induced risk and cancer, and discuss radiation-induced risk and genetic effects, and low doses on fertility. So let's start off with what epidemiology is. Scientists use the information from epidemiologic studies to formulate dose-response estimates and to predict the risk of cancer in human populations exposed to low doses of ionizing radiation. Epidemiology is defined as the science that deals with the incidence, distribution, and control of the disease in a population, and it's used to predict irradiation-related malignancies versus naturally occurring incidents of cancer in the population. Epidemiology studies of exposed populations, such as the Japanese atomic bomb survivors, they provide proof that high radiation doses induce cancer in humans later on. So what are late effects? We know that early effects of radiation exposure are produced by high radiation doses, and late effects of radiation exposure are a result of low doses delivered over a long period of time. Radiation exposures experienced by personnel in diagnostic imaging are low dose and are low linear energy transfer forms of radiation. In addition, the exposures in diagnostic imaging are delivered intermittently over long periods of time. So the principle of late effects of low dose radiation over long periods consists of radiation-induced malignancy and genetic effects. The lifespan or shortening and effect on local tissues also have been reported as late effects, but these are not considered significant. Radiation protection guides are based on suspected or observed late effects of radiation and on an assumed linear non-threshold dose-response relationship. Late effects occur over months or years after the irradiation, and the effect has no threshold. It occurs arbitrarily, has a severity that does not depend on the dose received, and is referred to as late stochastic effect. Cancer is the most important late stochastic somatic effect. That means it affects the entire body by an exposure to ionizing radiation. Now, on the other hand, effects that are directly related to the dose received, that occurs later on, years or months, are called late deterministic somatic effects. And an example of this is a cataract of the eye, whereas an example of a stochastic effect is cancer of the thyroid gland. Late effects may be due to previous whole or partial body acute exposures. It may be due to previous high radiation doses, and it is the long-term low-level doses sustained over several years. So what are the tissue effects that may occur? Temporary hair loss or permanent hair loss, which we've mentioned in prior modules, occur at large radiation doses. Chronic irradiation of the skin can lead to radiodermatitis. Chronic irradiation of the blood could lead to leukemia or aplastic anemia, as in the case of Marie Curie. Chronic irradiation of the lens of the eye will result in cataracts, as already mentioned. And to put it in perspective, let's use Dr. William Rowlands as an example. Now, he was a dentist. He was a graduate of the Harvard Dental and Medical School, and he practiced dentistry in the Boston area in the 1800s. 8 months after Röntgen discovered X-ray, he was using it in the form of a fluoroscopy unit to take intraoral images of the teeth. Now, while working with X-rays, he suffered severe burns to his hands, and he was amongst the first to warn about the adverse effects of radiation, and he urged the use of the least amount of exposure possible to make a diagnosis. But Dr. William Rowlands, he developed radiodermatitis, which is basically a significant reddening of the skin caused by an excessive exposure to ionizing radiation. But this How it links to late effects is that this eventually led to cancerous lesions on his hands and his fingers. Research has shown that repeated radiation injuries have a cumulative effect. So hence a percentage, approximately 10% of the radiation-induced damage, as we mentioned in the last unit, is irreparable, whereas the remaining 90% may repair over time. Now with Dr. William Rowlands, of course, 10% of the severe skin burns that he induced because of radiation, 10% did not recover, and so this led to cancerous lesions of his hands and fingers. So when looking at the late effects of radiation, what is the whole point of using a dose-response curve? Radiobiologists engaged in research with a common goal to establish relationships between radiation and the dose response. The information obtained can be used to attempt to predict the risk of occurrence of malignancies in human populations that have been exposed to low levels of ionizing radiation. Now, the radiation dose-response relationship is demonstrated graphically through a curve that maps the observed effects of radiation exposure in relationship to the dose of the radiation received. As the dose escalates, so do more effects. In such a dose-response curve, the variables or numbers are plotted along the axis of the graph to demonstrate the relationship between the dose received and the biological effect observed, which is on the vertical axis. Now, the curve is either linear, a straight line, or it is non-linear, which is curved to some degree, and it depicts either a threshold dose or a non-threshold dose. Now, looking at the term threshold, it may be defined as a point at which a response or reaction to an increasing stimulus first occurs. With reference to ionizing radiation, this means that below a certain radiation level, no biological effect is observed. Biological effects begin to occur only when the threshold level or dose is reached. So a non-threshold relationship indicates that any radiation dose has the capability of producing a biological effect. Some biological effects will be caused in living organisms by even the smallest dose of ionizing radiation. So in saying that, no radiation dose can be considered absolutely safe. There are three major types of late stochastic effects, which is carcinogenesis, cataractogenesis, and embryology or birth defects. Of these, carcinogenesis and embryology effects are considered stochastic events, and cataractogenesis is that late deterministic effect. At low doses below 0.1 sievert, which include groups such as occupationally exposed individuals and virtually all the patients we deal with in diagnostic radiology, the risk is not directly measurable in the population studies. Either the risk is overshadowed by other causes like genetic predisposition, lifestyle factors, perhaps the person smokes, or environmental exposure where they live, or the risk is considered to be zero. So very often it is really hard to determine what has caused the effect. Although no conclusive proof exists that low-level ionizing radiation doses below 0.1 cause a significant increase in the risk of malignancy, the risk is, in fact, or may be negligible or even non-existent. However, we know that the dose is cumulative, so care must be taken because we know that stochastic effects could be initiated by even the smallest amount of radiation. It is therefore our responsibility to minimize the probability of stochastic effects by building a safety culture and applying those ALARA principles as low as reasonably achievable. Let's use the chest X-ray as an example. Typically, we only produce about 0.06 millisievert from a 2-view chest X-ray, which is far lower than what is considered a low-level exposure. However, this could accumulate over time if the patient has more X-rays, resulting in slowly developing changes to the body from the radiation exposure. So even though a chest X-ray provides doses well below what is considered to be threatening to the patient, we still have to exercise caution. Here we have a linear quadratic non-threshold curve, which estimates the risk associated with low-level radiation, such as those used in diagnostic radiology. There are radiation protection committees that believe that the linear quadratic non-threshold curve accurately predicts or reflects stochastic and genetic effects at low dose levels from low linear energy transfer forms of radiation, like X-ray. Health concerns that are presumed to follow this curve include leukemia and breast cancer and hereditary damage. So that being said, a linear non-threshold curve is currently used for most types of cancer. So what are the genetic effects of ionizing radiation? Those are effects on biological tissue, on generations yet unborn. Now, the only concrete evidence showing that ionizing radiation causes genetic effects comes from extensive experiments with fruit flies and mice at high radiation doses. The data indicates that hereditary effects do not have a threshold dose. And this implies, once again, that even the smallest amount of radiation does or could cause some hereditary damage. There is no such thing as a 100% safe gonadal radiation dose. Currently, evidence of radiation-induced hereditary effects has not been observed in persons employed in diagnostic imaging or in patients undergoing radiological examinations. In order to minimize the possibility of hereditary effects in medical imaging workers and patients alike, gonadal shielding must be used effectively, and all radiation exposures must be maintained at low doses, as low as reasonably achievable. We know that radiation-induced abnormalities are caused by unrepaired damage to the DNA molecules in the sperm or the ova of an adult. And in history, test groups of children were observed after one or both parents had been exposed to radiation. An example of this is the survivors of the atomic bomb. Luckily, in our field, radiation doses are really low, so such an effect is highly unlikely. Here are a couple of examples of radiation-induced abnormalities caused by unrepaired damage to DNA molecules in the sperm and the ova of the adults, which have affected their offspring. So this is mostly a review on your part because we've already discussed fertility, but we know that germ cells control fertility, and many studies have been performed to document radiation effects on fertility. As mentioned in the last lesson, some early deterministic effects occurs at doses as low as 0.1 gray and can depress the male sperm population and delay or suppress menstruation. The most frequent mutations in humans are not those leading to deformed children or obvious hereditary disease, but rather those causing minor changes leading to higher embryonic death rates or lower life expectancy or increased diseases or even decreased fertility. Temporary sterility may occur or last as long as 12 months. And when sterility does occur, the chromosome abnormalities that are prevalent may be passed on to future generations. And for females, impaired fertility may not be the only consequence. Genetic mutations are possible. Mutations refers to changes to the somatic cells that would affect the individual when the cells divide, as opposed to genetic, which refers to changes to the germ cells that would affect the future generations. Either way, the frequency of the occurrence of mutations in the individual or changes to the germ cells that would affect future generations, this will increase in proportion to the magnitude of the absorbed dose received. At the end of the day, carcinogenesis or cancer is considered to be the most important late stochastic effect caused by exposure to ionizing radiation. As previously discussed, this effect is a random occurrence that does not seem to have a threshold, and for which the severity of the disease is not dose-related. For example, a patient's leukemia induced by a low-dose exposure is no different from a person's leukemia that was caused by a high radiation dose. So I have a few summary points embedded here that you can review on your own, as well as a few review questions. So that's it for this lesson. Next, we will move on to the effects on the embryo and the fetus and the child.